The Way to Wellness, brought to you by OnePeak Medical.
Today on The Way to Wellness, we're joined by Kalina, family nurse practitioner at OnePeak Medical. Sarah is here to help us make sense of what your body's trying to tell you and share simple, practical steps that you can take to start feeling better. Today, we're diving into sleep apnea. Sarah, thank you for joining me.
Thank you, Emily.
So what is sleep apnea and what are some common signs or symptoms people should look out for?
So sleep apnea, particularly obstructive sleep apnea, is when you're sleeping at night and your airway actually closes. Common symptoms are when you wake up in the morning or throughout the day feeling excessively tired, especially when you're doing kind of day-to-day activities, maybe your job or reading or even driving a car.
So how is sleep apnea diagnosed and what treatment options are available?
So sleep apnea is diagnosed traditionally in a sleep lab, but most commonly nowadays we do home sleep studies. The common treatment options for it, and in fact the gold standard, is to use a positive airway pressure device, more commonly known as a CPAP. However, there's a lot of other lifestyle factors we can do to reduce the severity of sleep apnea. A big one is weight loss. There's actually a new medication called Zepbound or tirzepatide that's used, and often with that medication, sleep apnea severity reduces by about half. Other things you can do, obviously weight loss, sometimes sleep positioning, sleeping on your side, avoiding sedatives or hypnotics. Those are all big things.
And Sarah, when should someone see a provider about potential sleep apnea?
Yeah, kind of like we talked about. If you're having that, man, I'm just falling asleep doing day-to-day activities, you should definitely get that checked out.
Definitely. Thank you for joining us.
Thank you.